Welcome to our Medtronic Endoflip demonstration at the 7th annual AWE endoscopy course. I am so pleased to introduce our esteemed guest, Dr. Ming from West LA Kaiser, and so grateful to have you here for your fourth time, actually. Thank you.
It's a pleasure to be here and to come back and see how the course has grown. And it's my pleasure to talk to you today about the Endoflip device, which some of you may already be familiar with, but I find this to be incredibly useful in my practice because I do per-oral endoscopic myotomy for the treatment of achalasia, and that is the application for which this device is really ideally designed. So for those of you who are not familiar with the Endoflip, it's essentially an endoluminal device involving a very flexible balloon, which you can see here, which is filled with a saline. And this balloon essentially inflates to preset, millimeters of inflation. And the purpose of this balloon is really to give you essentially real-time manometric equivalent data on esophageal motility, and specifically in the case of achalasia, we want to understand information about the lower esophageal sphincter's compliance and sensibility. And so it provides both a pressure measurement as well as a diameter or size measurement for measurement of the LES.
So for our novice endoscopist, so we introduced that obviously not inflated through the channel of an endoscope, and how do we position within the esophagus?
So good question. So this is actually not inserted through the channel of the endoscope, it's inserted through the mouth orally. So this device has already been primed. And you can see this particular device is primed already at 40 mils of inflation, which is the catheter volume, and it's inflated through a syringe that contains saline, and that's pushed through the catheter into the balloon to a preset mils of inflation. And so when the initial setup is actually in the newer generation model. This is the newest generation model. It's very streamlined. There's just kind of literally a click and guide, step-by-step guide. It's very easy and very intuitive. But once it is preset, this device deflated is inserted into the patient's mouth and lowered into the esophagus. And you always want to know what the based on your pre-endoscopy, what the measurement of the lower esophageal sphincter is. And then there are markings on the device, although they're small, but you can definitely find the markings for centimeter markings, and usually, the lower LES you expect to be about 40, 45, and so you kind of put a piece of tape around it, that's how I do it, and measure where the LES is, and you just insert the balloon up to that level where the LES is. And then you subsequently inflate that balloon to the pre-desired volume. This is a 16 centimeter balloon. There's also an 8 centimeter balloon. For poem purposes, I generally just use the 8 centimeter balloon and inflate it to anywhere from 30 mils to 40 mils. And then really the key measurements is, I'm going to use my hand as an example, but you can see my hand is pinching in the midpoint of the balloon. So this is kind of mimicking where the lower esophageal sphincter would be. And you can see, if you could pause live. Perfect. So this is the image that you're going to get on your Endoflip imaging device, and what you see here is a very tight high pressure zone in the midpoint of this catheter where my hand is pinching, but in the patient presumably where the lower esophageal sphincter is pinching. The high pressure zone is right here, and this balloon gives you a measurement right out here of both the pressure. Sorry, can you unpause live? And you can see how the data kind of changes as the balloon is, so for example, I have a meat masher here, but you can kind of see, like, if you were to pinch it at different points, it gives you slightly different measurements on the diameter and the distensibility. Normally there is a read on the distensibility. I'm not sure why it's not popping up, but the distensibility index is not being read out here. Not sure if but there is a distensibility index that's normally here. And the distensibility basically tells you about the compliance at the LES, essentially the pressure measurement at the LES. And the diameter is the actual diameter of the lumen at the point where the high pressure zone is. And so clinically, where it's helpful, this is a topography map, which basically shows you the peristaltic waves as it goes through the balloon. So mimicking kind of the peristaltic waves of the esophageal body as waves of peristalsis go down. I don't necessarily use the topography map that much, but that's kind of present as well as an extra feature. But clinically, what I use it for, especially in POEM, is doing a intraoperative, kind of almost real-time manometric measurement of the LES pre-POEM and post-POEM to check the adequacy of the myotomy. So if you have a very tight LES prior to your myotomy, post-POEM, you do this measurement again, you should hopefully see a significant improvement in both the diameter and the distensibility index. Generally, the data suggests that if you have a post-myotomy distensibility index above 3.5, that suggests there is an adequate myotomy. So that's where it's clinically most useful, I think.
Well, thank you so much, Ming, for that wonderful explanation and demonstration of this technology.